mass media campaigns, a favorite in the public health community, a favorite in the health promotion community, but often debatable in terms of their impact, and we'll talk about that briefly. But what is a mass media campaign? Well, essentially, it's using marketing techniques to promote health or promote a healthy behavior, at least what we conceptualize as a healthy behavior. And what this does when you're using marketing techniques to change for public health purposes, it's called social marketing. Essentially, you're trying to impact large populations using simple ad campaigns. Mass media campaigns have come in three types. They are the classic public service announcements, they're counter advertising, and then there's the use of warning labels, which are actually on the product pack. So counter advertising and warning labels are really only for legal substances, so tobacco, alcohol, and marijuana in some states. Here in the US, PSAs have been used for pretty much any type of substance out there. These are classic PSA, public service announcements posters. They tend to use scare tactics. They tend to use kind of just straight health education. And here are some newer examples of what has been used in New York City, as well as I believe the meth project was in the upper Midwest. Counter advertising focuses on giving people information about the industries that produce a product, how the product is produced, and what the effects of that are. So these are images from the Truth Campaign, which was funded out of the Master Settlement Agreement between the Attorneys Generals here in the United States and the tobacco industry itself. And what they did, they didn't focus just on how much disease tobacco causes. They didn't focus just on how much cancer, lung cancer, tobacco smoking causes. What they did was they used the internal documents that were available from the Master Settlement Agreement to shine light on industry practices. They told people that this is the information they've been hiding. They knew nicotine was addictive and they hid it from you. They knew tobacco cigarettes were dangerous and they hid it from you. They knew that their products were killing tens of thousands of people a day and they hid it to you. And here's all the ways that they make cigarettes taste better than they actually are and convince you that they're not quite as dangerous as they actually are. So by doing this, by providing the information about how the products were actually designed, they actually can produce behavior change. People don't like to be tricked and deceived. So essentially they're saying, here's how an industry has deceived you, and here's why you shouldn't use the product anymore. And finally, warning labels. Again, warning labels are really only put on legal products. I don't know of any instances of a drug cartel, for example, putting a warning label on cocaine. But we do have warning labels on alcohol. Here are some examples, or here are potential examples from Australia. They're very straightforward. They're not all that graphic. And really the effectiveness of alcohol warning labels in this form hasn't really been there. The research has shown that yes, they might increase knowledge of certain consequences of alcohol use, but they haven't really impacted behavior change as of yet. Here's an example of a marijuana warning label that's being used in Colorado. It's mandated to be used in Colorado on their products. Again, this one is probably not all that effective. There's a lot of words, there's a lot of text, and the average person isn't necessarily going to read through them. But here are some of the graphic warning labels that are used on tobacco products, particularly on cigarettes. They not only contain the health information, these are the ones from Canada, but they contain a very graphic image about what the product can do for you, or something that procedure such as with the eye thing that you wouldn't necessarily want to go through. These are intended to be hard to look at. They're intended to produce a very negative emotional response. And compared to the warning labels being promoted or used on alcohol in the US and those proposed in Australia, compared to the warning label used on marijuana in Colorado, these elicit very strong negative emotions that those simply can't. You just can't do it unless you have that graphic image. In addition to these, the ones in the health warning labels used in Canada also have quit line information. So if someone sees this and they're a current smoker and they finally decide to quit, then they have the information available around them to do so. So the key question of all of this is, are they effective? When used alone, not really. Mass media campaigns don't really have much of an independent effect in terms of substance use. Again, it's very similar to some of the school-based programs where they have a statistically significant impact, but practically speaking, they're not changing behavior all that much, even if they increase knowledge, even if they change attitudes. But when they're used in combination with other interventions, they can work. So they can raise awareness of other interventions. So a mass media campaign of warning people that there's going to be traffic stops for DUIs and drunk driving stops can increase the intervention of those drunk driving stops. So people will not drink as much. People won't drink and drive as much because they knew that the stops were going to be there. And if they reinforce the message of other interventions, so if they work in cohesion, in cooperation with other interventions and other policies, they can have an impact. So those tobacco warning labels, those graphic warning labels, which should make you have this very negative emotional response, have some limited impact on their own, but work really well when it's within this policy environment that is denormalizing tobacco use. So when you increase taxes on tobacco, when you have secondhand smoke restrictions, so you can't smoke inside and you can't smoke in public spaces even if it's outdoor public spaces. When you combine all of those and it's part of a comprehensive package of interventions, then these messages can work. And they're most effective when the behavior isn't common, isn't a habit. So if you're only drinking once in a while, a mass media campaign will have more impact than if you're drinking every day. If you haven't used tobacco, the mass media campaign is going to be more impactful than if you're already a current tobacco smoker and you're addicted to nicotine. So for mass media campaigns to be effective, or most effective, they need to be used in combination with other interventions, whether it's behavioral interventions or policy interventions, and they're most effective when the behavior is more sporadic than whether it's a constant daily occurrence. So if you're interested in mass media campaigns and you're interested in conducting and implementing a mass media campaign, keep these basic recommendations in mind, which were published by Melanie Wakefield et al. In 2010. And these are very common sense regulations. Essentially, it's mass media campaigns work, but they should be part of a comprehensive package. There needs to be enough funding and resources to actually implement the mass media campaign. It does no good to just have one ad published one time on one TV network. You really need to have a comprehensive marketing strategy to get your message across. And if you're going to promote something like quitting a substance or reducing your use, make sure that there's the systems in place to help people do that. If you tell people to quit smoking, but then they don't have any resources to actually help them do that, it's not going to be effective. And finally, everything that's done between the messages that are developed as well as the campaign itself and how it's going to be implemented needs to be researched and tested. The messages need to be at least have some level of efficacy before determining whether they're effective, and you really need to test your messages before delivering them at the population-wide level. So these are the basic recommendations for implementing a mass media campaign, and again, at least in my opinion, they're very common sense. Essentially, do your research, do your homework, make sure there's money behind it so it's effective, and do it as part of a comprehensive package rather than a standalone program all by itself.